Good afternoon, everyone. Are you all ready to go? Well, welcome. Good afternoon. We are now at the American Academy of Pediatrics, 21st Century, the Trauma-Informed Pediatrician, Identifying Toxic Stress and Promoting Resilience. I'm Nancy Harper. I'm the Programming Chair for the section on Child Abuse and Neglect. We so appreciate the enthusiastic response this conference has generated. I think we have broken records for the American Academy of Pediatrics from prior PEDS 21 offerings. Please sit wherever there are open seats, especially in the front, unless the table says reserved. The fire code will not allow any attendees to stand near the doors. There's also chairs in the back, and there's an overflow room. Please also turn your cell phones to vibrate if you haven't done that already, so we don't distract other attendees from the speakers. There'll be another opportunity at the break to visit the posters if you haven't done so already. The abstracts will also be available, and they are already, and they will be as a handout on the NCE website. Remember, as you saw on the slide while you were sitting eating lunch, that you're going to receive an email about completing the post-test so you can get your MOC credit. Please also complete your evaluation, as your feedback is incredibly important as it helps us develop our future programs. There's also on your tables, as you see the yellow cards, people see your yellow cards on your table? Those are for the question and answer session. Please fill those out while you listen to the speakers and look for staffers and turn in your cards. We'll use cards during the question and answer session. You'll see microphones that'll be set up during the break. The microphones will be used during the community resources panel so that you can ask live questions, but we'll use the cards during the Q&As. And with that, I would like to welcome the American Academy of Pediatrics President, Dr. Sandy Hassink.
It's so good to be with all of you today to talk about a topic that is so important to all of our children, all of our parents and families, and all of us. And I think to have this resilience and toxic stress and one of the very foundational issues in pediatrics addressed by the Pediatrics for the 21st Century is timely, important, and I think we're going to remember this moment as we move into the future, focused on how we as pediatricians have a voice in the national discussion, in the state discussion, in the discussion in our communities of what children need, what every child needs, and what is so important to building the foundations of child health. So we know that millions of children and adolescents are exposed to violence or victimized by violence in our country every year. And there's not one of us, I think, now that hasn't pondered the landmark Adverse Childhood Events study that showed that our adults who are exposed to violence and other childhood adverse experience suffer greatly throughout their life course from a whole host of chronic disease, both physical, chronic disease, psychosocial issues, mental health problems. And so this ties us directly as pediatricians to the state of adult health in our country. We know that our statement on toxic stress and resilience made a strong case for the underlying biologic mechanisms of toxic stress. And this gives us our scientific underpinnings for our advocacy and our clinical care. And we have the opportunity here to help our children from the earliest ages build resilience. Our families understand child development, healthy parenting, the importance of interacting in a positive, empowering way with their children. And through their collaboration, the Academy sections on child abuse and neglect, adolescent health and development, behavioral pediatrics, our councils on foster care, adoption and kinship care, and injury and violence prevention have put together this wonderful symposium for you. And you can see just by the amount of committee, council, and section participation how important this topic is to all of us and to the entire Academy. So I want to take a moment to thank all the people who participated in preparing this wonderful program for us and the kickoff for PEDS 21 and our NCE. So let's give them a round of applause. But before we begin with our symposium, I have a very special privilege, and I do mean privilege. I have the honor of recognizing an exceptional pediatrician with the 2015 Gold Foundation Humanism in Medicine Award for her work in this area. The Humanism in Medicine Award honors practicing physicians who best demonstrate the ideals of compassionate and respectful care for patients' physical and emotional well-being. And the woman we honor today exemplifies the attributes of a humanistic doctor in all aspects of her career. Dr. Denise Dowd has been a pediatric emergency physician for over 20 years and has set the tone in her emergency department for all to follow. Passion for each child and family, humor to take the edge off the day's events, and collaboration with providers without regard to training or level of background. Denise's commitment continues outside the emergency department in her work on injury and violence prevention. She works at both the local and national level. Locally, she and a nursing colleague initiated a domestic violence task force and that has transformed the way Mercy Children's Hospital approaches children and families at risk. In addition, she organized a mental health and gun safety campaign for the local school district and helped organize Operation Breakthrough, an organization that provides services to over 700 high-risk children and families coordinated through the local Head Start program. At the national level, Dr. Dowd has dedicated so many hours, more hours than we can count, most recently serving on the AAP Council on Injury and Violence and Poison Prevention, and has authored the valuable policies we have on firearms and intimate partner violence, as well as serving as the chairperson of the Department of Justice-funded medical home for children exposed to violence on their Project Advisory Committee. Dr. Dowd is also devoted to the professional development of her trainees and peers and has given more presentations in her 20 years than most of us will ever give in our lifetime. But what is perhaps most impressive about Dr. Dowd is her compassion and dedication to children and families who have experienced violence. In a chaotic ED, she sees the opportunity to identify and help children who have been exposed to intimate partner and community violence and prevented this risk of other adverse events. Denise champions connecting the children and families to community services and breaking this cycle of toxic violence in a child's life. It is an honor to present the Gold Foundation Humanism in Medicine Award to a true humanitarian who makes a profound difference in the lives of so many children. Dr. Denise Dowd.